Hello, everybody. My name is Sudi Julai. This is the part 2 of our qualitative research method workshop. As you may remember, the last time we ended up talking about the sampling methods and different methods that we use for sampling in qualitative research that is quite different with the sampling that we use for quantitative research. Now I'm going to share my screen to continue this section. Okay. As you see, we are moving forward with comparing the different components of different approaches of uh, qualitative research. So in terms of goal in phenomenology, we want to understand the essence of individual experience. The participants are individuals who experienced a phenomenon of interest. The sampling is usually small, between 1 to 20 people, and the outcome is multi-format. We can have deliverables in multi-formats. We maybe have time to discuss it later. In case study, we want to highlight individual cases and or relationship between them, provide context to other data. One or more cases might be our participants, one or several people or cases might be in our samples, and primarily text is something that we deliver as outcome. In grounded theory, we want to develop a theory grounded in the data that we have. The participants are community, group, researcher, and other relevant parties. The sampling is in a community or group unit, and the outcome is the social change that we expect. In the mixed methods, that is a combination of qualitative and quantitative research, we want to overcome limitations of a single methodology. The participants might be individuals or groups. The sampling vary based on the methods that is used, and the outcome might be both text and statistics. Grounded theory methodology is suitable to study of any behavior that has an interactional element to it, a set of rigorous research procedures leading to the emergence of conceptual categories. Multiple analytical frameworks is being used, and term describe both a research method, a particular research process, as well as outcome, which generates a theory grounded in the data. In grounded theory method, we need to identify our area of interest, collect data, we do open coding for analysis, data collection, analysis, and emergent interpretation occurs simultaneously. It means that at the same time that we are collecting the data from the interviews, focus groups, we analyze that, and we, based on the data we capture, we go toward the next interview or focus group. Writing memos is important, writing down the hows, whys of our emerging codes. Selective coding and theoretical sampling focus on core categories, and we can sort memos and find theoretical codes. Main code emerges gradually, and we need to read literature afterward. The final outcome of grounded theory offers an explanation of the phenomenon under examination and should be traceable back through the data. It can be used with either qualitative or quantitative data of any type, like video, images, text, observations, spoken words, etc. It's commonly used both implicitly and explicitly in most qualitative research, even if we are not mentioning that we are doing a grounded theory in the analysis process. We might use the approaches that is used in grounded theory, like constant comparative analysis. I'm gonna provide some papers that used this specific methodology for you to review and see what is going on over there. So I have provided an example for grounded theory here. The title is Grounded Theory of Resilience Experiences of Women with Gynecological Cancer, that is in European Journal of Oncology Nurses, and I put the link here for you. Another approach is community-based participatory and action research methodology. This is a partnership approach to research that equitably involves diverse community members, organizations, representatives, and researchers in all aspects of research process. Seeks to understand the world by trying to change it collaboratively and following reflection. Goal is to increase and integrate the knowledge gained with interventions, policy, and social change to improve the health and quality of life of community members. Not a unified body of ideas and methods, but rather a pluralistic orientation to knowledge making and social change. Actually, action research or participatory action research starts from a problem that comes from the community members rather than from the researchers. An example of a paper that is based on participatory action research is realizing radical potential, building community power in primary healthcare through participatory action research. And you have the link here to go through and review that. There is another approach. Actually, this is not a qualitative or quantitative method. This is based on the aim of the research. This category is patient-oriented research that might be qualitative or quantitative. This is similar to community-based research, but with a specific focus on collaborative teams of patients, decision makers, healthcare providers, and researchers. Engages patients as partners, focuses on patient-identified priorities, and improves patient outcome. Aims to apply knowledge generated to improve healthcare system and practices. Patients include anyone who has experience with the healthcare system or a health issue, including informal caregivers, an approach that is applicable to both qualitative and quantitative health research. I have an example here for you, researching what matters to improve chronic pain care in Canada, a priority setting partnership process to support patient-oriented research. Actually, this also can be under participatory action research. This is somehow a subcategory of that. In mixed methodology, we collect, analyze, and integrate or mix quantitative and qualitative research and data in a single study or a longitudinal program of inquiry. Data need to be mixed in some way so that together they form a more complete picture than when alone. Need to address productive tensions between methods, actions, and methodologies underlying philosophy, which is very important. Encourages collaboration between professions and disciplinary fields. Increasingly popular in healthcare research because when you have some numbers showing something, you want to go deeper, you want to do some interview with the number of participants who get a more deeper understanding of the situation. An example of mixed method is a case management in primary care for frequent users of healthcare services, a mixed methods study that you can find that in the Annals of Family Medicine. There are different methods or types of data collection in qualitative research. The most common method for data collection is interviews. And we have also focus groups, we have document review, participant observation, and triangulation that is, using more than one data collection method. There are some benefits and limitations for each data collection method that we review that together. For individual interview, this allows participants to express their own ideas, allows interviewer to be responsive to individual differences and situational circumstances. While there are some limitations for that, like minimal control over the order in which the topics are covered, usually small sample size, limited due to cost and time. For a focus group interview, actually, it allows organized discussion structured in a flexible way, provides opportunity for all to participate and give their opinions. Dominant and submissive participants can be directed and controlled. Discussion generated between participants, large quantity of information collected in a short amount of time. And also you can see interaction between different people, different participants in the group. There are also limitations for that. Researchers have less control over the flow of discussion. Facilitating focus groups interviews requires considerable skills. Difficult to distinguish between individual view and group view, and more difficult to organize and order data for analysis. We have also observations as a data collection method that might be involved observation or detached observation. For involved observation, we know that it allows researcher immersion and prolonged involvement with participants, encourages free and open conversation with the participants. The limitation is altered behaviors of observed groups by the presence of the researcher, takes time to build trust with participants. So when you as an external observer go to a group, it may change the behavior that participants do in their regular or daily life or work. We have also detached observation, reveals descriptions of behaviors by stepping outside the group, allows identification of recurring patterns of behaviors that participants may be unable to recognize or reveal themselves. There is a potential researcher bias in the design of a study while using this method. Sources or participants may not be equally credible, and analysis of observation can be biased. Interviews might be informal, unstructured, semi-structured, and structured, different type of interviews. An informal interview, researcher is required to recollect discussion. In unstructured interviews, researcher allows interview to proceed at respondents' pace and subject to vary by interviewee somehow to an extent. In semi-structured interview, researcher uses an interview guide, but respondent is given freedom to respond. In a structured interviews, researcher uses identical situations and adheres to interview schedule. Actually, in most research in healthcare, we use semi-structured interview. We have an interview guide. We don't go through the questions one by one, but we have something in mind that what do we want to ask and how we are going to proceed. But also we provide freedom to the participants to, to explain their feelings, their experiences, and if everything goes well, it's a very good method for data collection. You can think about what might be the features of a desirable environment for the conduct of a qualitative interview. I'm sure this need to be think about, a quiet, private space. You need to make sure that there is no one else listening or hearing your voices. For example, a cafeteria or a public coffee shop won't be a very good place for doing the interview. So we always need to think about the place that we want to do interviews. We also need to consider, our safety. If participants ask us to go to their home for interview, this is something that need to be, uh, considered regarding your safety. How much trust do you have to that participants, and all of those aspects need to be, thought of before doing the interviews. A focus group is another method for uh, qualitative data collection. This can gather more data in a short period of time. In a time that you interview one person, you may have 5, 6% in a focus group. That creates more data. But as I said, there is some benefits and some limitations. Focus groups are a group of interacting individuals having some common interests or characteristics brought together by a moderator who uses the group and its interaction as a way to gain information about a specific or focused issue. Is useful in understanding how or why people hold certain beliefs about a topic or a program of interest. You need to have an interview guide for your or focus group guide for your session. Do ask open-ended questions. Do leave your assumptions at the door. You should think that you know nothing and just listen. Do take notes, do validate and empower, do maintain eye contact with all members of the group, do rephrase your questions and probe is a very important issue. It means that when a participant says something, ask probe questions to clarify what exactly do they mean when they say something. Never ask closed questions. Don't interrupt or tell your own story. Don't lead or put words in their mouths. Don't judge. Don't be afraid to redirect, and don't be afraid of the silence. These are the important tips that you need to consider when do a one-to-one interview or a focus group. As I mentioned before, you need to have a guide. It doesn't mean that you go through all of those questions that you have in your interview guide, but it helps you to, to organize your thoughts, your minds when you are doing interviews. The interview is a guide. Typically, qualitative visits are unstructured or semi-structured, does not need to be read verbatim. Interviewer needs a very good understanding of the research question and probe, create a certain amount of order on topic areas that your question covers and then follow in a reasonable order, but you can jump around depending on how the participants lead the conversations. You have types of questions that might be in your interview guide, questions regarding their background, behaviors or experiences, opinions or beliefs, sensory experiences. Focus on research questions and formulate questions that are concretely oriented to answer it, but avoid the specific questions. Use language that is relevant and understandable to participants. This is very important when you are developing your interview guide. You need to have your research question and research goal in front of you and create some questions to answer that question and help you to achieve the research goal, but never use the research question and break it down to some questions to the interview questions. You need to have open-ended questions, not closed-ended questions. The difference between these two is when a study looking at how experiences with stigma affect people with mental health conditions. You may ask all participants, actually, sorry, for closed-ended questions, all participants answer same questions for comparison. Have you experienced a stigma? The answer is yes or no. Does a stigma affect your decision to seek care for your mental health condition? Yes or no. While in open-ended questions, participants respond in their own words. Like, how has your experience with a stigma affected your daily functioning? They need to explain that feeling or experience. Or please describe how your experience with a stigma has affected your decision to seek care for your mental health condition. Our questions need to be something that make them think and make them want to share their experiences and their feelings. Don't lead or put words in participants' mouth. Example, a study looking at differences in parent and child attitudes surrounding social media. Participant says, sometimes my mother and I fight when I want to go on Facebook. You say, so tell me more about how you hate your mother. Oh my God, what are you talking about? She didn't say anything about hate between her and her mother. Well, you can say, when they say sometimes my mother and I fight when I want to go on Facebook, you can say, can you describe more about what you and your mother fight about? This is a very reasonable way of, probe questions to clarify what do they really mean instead of, putting a word that you think may describe those kind of fight between them. Do take notes during your interviews and focus groups. One important piece of the interview are the notes, observations, or memos that the interviewer or researcher makes down. Notes should be used more for contextual information rather than content. For example, participants is teary-eyed and at this question, participants is agitated. Participant avoids eye contact. Participants tenses up and rocks back and forth. Anything that would not be captured on the audio recording, like body language or facial expression, these all are something that you need to take notes about that. You do not need to write down everything the participant says because they are in the audio recording. Take notes both during study visits and also during the analysis process. One important thing to remember, qualitative data is transcribed verbatim. One limitation of qualitative is it can be easily misinterpreted. For example, these kids are driving me crazy. The tone, impression of the statement changes depending if the participant is speaking in sad, angry, or joking manner. Notes and memos are very important because when it is transcribed, you don't have the tone, you don't have the feelings besides that words that the mother said. Do probe. This is very important. In a quantitative survey collection, the data is what it is. Over the last 2 weeks, how often have you been not able to stop or control worrying? Not at all. Several days, more than half the days, nearly every day. But in qualitative, you can probe for more context, what they have been unable to stop worrying about, how that's affected their everyday functioning, how does the worrying manifest. You can also probe depending on where the participant is leading you. Probes can include who, why, when, in what circumstances, how did it feel physically, emotionally, severity, how do you feel now, how often were you experiencing it, how much did it impact your daily life, how did friends, family, community react. And these probe questions are very important to deepen the data that you are gathering from the participants. Participant observation is another method for gathering data in qualitative research, particularly in anthropology, to gain a close and intimate familiarity with a given group of individuals and their practices through an intensive involvement with people in their cultural environment, usually over an extended period of time. Useful for thick description, the detailed account of field experiences in which the researcher makes explicit the patterns of cultural and social relationship and puts them in context. Field notes are the systemic description of events, behaviors, and artifacts in the social setting chosen for the study. There are different kinds of observations. You can be a passive observer, moderate observer, or active observer. The challenges are boundary blurring, impression management, need for personal reflexivity, front stage behavior, ethical considerations, time commitment can be or feel overwhelming. You might be a complete participant. Researcher is immersed in group community, and research is usually concealed or covert. You have participant as you might be a participant as observer. Researcher steps into and out of groups, community intervention. Research is known or open. You have observer as participants. Researcher mainly observes, but occasionally enters field for brief intervention. Research is known or open. Complete observer is the case that researcher does not participate. Research is either non open or conceal or convert. Triangulation in your data collection or even in the methods means analyzing a research question from multiple perspectives to arrive at consistency across data sources or approaches. Combining multiple observers, theories, methods, and empirical materials to overcome the weakness or intrinsic biases and the problems that come from single method, single observer, and single theory studies used in both qualitative and quantitative research design. We have all the data we uh, gathered, and as I said, in qualitative research, data collection and data analysis are being conducted simultaneously because the data analysis can lead us to have a better data collection in the next interviews or observations or focus groups. The range of processes and procedures whereby we move from data that have been collected into some form of explanation, understanding, or interpretation of the people and situations we are investigating is qualitative data analysis. Analysis based on an interpretive philosophy. uh, Actually, we do interpret the data that we have. The idea is to examine the meaningful and symbolic content of qualitative data. We have a deductive approach again and an inductive approach for analysis. In deductive approach, researcher use his or her own research question to group the data, then look for similarities or differences, use when time resources are limited and dependent on uh, methodology. But in most qualitative researchers, we do inductive approach that using emergent framework to group the data and then look for relationships and taking back and forth between approaches. Uh, It's important to know that the primary message is content, the attitude of the speaker, whether content is meant to represent individual or group shared ideas, the degree which content speaker is representing actual versus hypothetical experience. It means that the actual experience or the experience that they might think about that. The qualitative research is uh, not using the same validity and reliability methods that is being used for quantitative research to make sure about trustworthiness or rigor in qualitative research. That is very important. We use different criteria. For example, we have credibility that is somehow equal to internal validity. The issue is the truth value. The solutions for that is prolonged and persistent observation, triangulation, peer debriefing, member checks, deviant case analysis. Actually, these all help. These are all measures that ensure credibility of data, transferability or external validity. Is about the issue of applicability, tick description, referential adequacy, reflexive journal and data saturation are some measures that we use to make sure about these criteria. Dependability, that somehow refers to reliability of data. The issue is to ensure consistency. So dependability audit, reflexive journals are some measures that we use to ensure achieving this criteria. And then conformability, that somehow equals objectivity. This is about the neutrality of data we collected, without judgment, without bias, without our personal attitudes, leading everything, data collection, data analysis, conformability, audits, and reflexive journals are also some measures that are helpful to ensure these criteria. So there are some terminology in qualitative analysis, like coding. Is the approach of attaching labels to lines of text so that the researcher can group and compare similar or related pieces of information. Characteristic is a single item or event in a text, smallest unit of analysis. Themes are idea categories that emerge from grouping of lower level data points. Theory is an interrelated set of concepts, definitions, and propositions that present a systematic review of events or situations by specifying relations between variables. For coding and developing analysis, we focus on attitudes, emotions, ideas, words, relationships, themes, and we read through first sentence coding, organize our codes, share with partner, refine codes. Actually, it's very important to do a manual coding for at least the first 2, 3 transcripts of interviews or focus groups that we have to get an understanding of what's going on in that interview. So we may have so many papers, notes, color codes to differentiate between different ideas or attitudes or emotions or whatever we have in the text. So you may see so many of these, you may have so many of these papers that, capturing some codes, categorizing those codes and changing and rechanging them over and over. Uh, There are some analytic softwares that are used for qualitative data analysis, but they are not actually analyzing the data. They are helping in data management rather than data analysis, because the researcher and the research team is the group that work on understanding what is going on in the transcription. It is possible to conduct qualitative analysis without software for sure. And as I emphasized, please do the first 2, 3 ones manually. Start with a manual coding for the first few transcripts. Can be analytical softwares can be used in all phases of data collection, analysis, and reporting. There are different data analysis softwares. There is Atlas, and there is NVivo that is mostly being used, very common. And there is a screenshot of NVivo being used for qualitative. This is very excellent for, for the comparing different groups in different aspects. So this is good to use qualitative data. I prefer to say data management softwares, but don't rely on them from the beginning. Just do your manual coding first, and then create a coding scheme, and then put your coding scheme in vivo and move forward from there. So we may have another workshop for how to use NVivo, but this is just a screenshot of how NVivo looks like. And this is a software that you have to pay for it. This is not free, and you may have to ask your team or organization to pay that for you. Qualitative reporting is also different from the quantitative reporting. The focus for academic reports are conceptual frameworks, theories, methodology, and interpretation. For practitioners, it is most concrete suggestions for better practice and policy recommendations. And for lay readers, this is about problem solving, reform, or practice policy. So it's important that who is the audience for the report that you are providing. The format might be like research report, academic journal article, report to donor, evaluation report, community capacity building, non-traditional, and multimedia reports. The ethics in qualitative research is also important. The main obligation is to ensure that participants are well informed. The purpose is risks and benefits, expectations of participations, how results will be used, reporting back, ownership of data. The ethics committee need to ensure that the data collection and all the processes were completely voluntary. There was no coercion. Captive and or vulnerable populations are very important in this regard. Need to examine historical, political, economic, and cultural aspects of you and your participants, and work for mutual benefit of all. Please make sure that when in doubt, ask and collaborate with us. We are here to help you to move forward with your research, both in the methodology aspects and in the ethical aspect. You can contact us anytime. Thank you for your time. I hope it has been helpful for you. See you in the next workshops to describe other aspects of qualitative research. Thank you.